Good morning, everybody, and welcome to the meeting of the Gloucestershire Health and Wellbeing Board. Apologies for starting the meeting a little late, we were just having a few technical issues. The first order of business for today is the board has to elect a chair for the coming year. So, board members, if I could have a nomination for the chair, please.
Tim Harman speaking. Can I nominate Councillor Carol Alloway-Martin?
Do we have a seconder for that, please?
Councillor Richard Boyles.
Thank you, Richard. Are there any other nominations? Okay, over to you then, Carol.
Thank you very much, members. It's my duty now to actually ask for the name and person to be elected as vice chairman. Do we have any nominations, please?
Can I nominate, if he's prepared to do it, Dr. Andy Seymour?
Do we have a seconder for that?
Yep, Councillor Richard Boyles, I'm happy to second Dr. Andy Seymour.
Thank you. Can I just check with Andy that he's prepared to do the role?
Yes, I am. Thank you.
Thank you, Andy. So we duly elect Dr. Andy Seymour as Deputy Chair. Andrea, could we have apologies for absence, please?
Yes, we have apologies from Deborah Lee from the Hospitals Trust, and we have Simon Lansley substituting for her. And we have apologies from Anna Brinkoff from Gloucester City, and John McGinty is substituting for her. We're also expecting to have the Police and Crime Commissioner on the line, as the Deputy Police and Crime Commissioner is unavailable today. And apologies from Councillor Cathy Williams.
Thank you very much, Andrea. I'd like to invite all members of the Health and Wellbeing Board to take this 1 minute of silence to reflect on the lives of people who've died, those who mourn them, and those who will be changed forever as a result of this global pandemic. 1 minute silence.
Starting now. That's 1 minute.
Thank you, members. We now move to the agenda items, and we continue with item 5, declarations of interest. Andrea, do we have any?
I haven't received any. If members do have any, they can always email me after the meeting if something pops up.
Thank you. We now move to item 6 on the agenda, minutes of the previous meeting, which are held on pages 1 to 4. So if we take page 1, page 2, page 3. Can I just clarify with Andrea and indeed with Sarah that there's no one indicating to speak? Thank you. I'll take those minutes as read and that they're agreed. Thank you, members. We now move to item 7 on the agenda, public questions.
Chair, no public questions were received by the deadline, and we haven't received any member questions either.
Thank you very much. It would be my plan that we try and encourage member questions and try and encourage public questions, because it's one of those opportunities where we can engage with the people of Gloucestershire. So we'll try and promote that as an item. Item 8 on the agenda, members' questions, of which we have none. Nope. And we now move on to the first paper of the meeting, which is item 9, COVID-19 Reset and Health Inequalities, pages 5 to 82. And I understand that Sarah is going to present this paper.
Thank you, Chair. I'm Sarah Scott, Director of Public Health, for those of you I've not met. I'm going to introduce my colleague, Jennifer Taylor, who is a lead commissioner in my team, who'll present the paper. But just by way of introduction, the paper seeks to discuss the impact of COVID-19 and how we might then move on as a board to the next stage of our response and recovery. And it's based on an LGA reset tool that was published at the beginning of June. So I think Jen will give you a much more detailed briefing on this, but we can try to incorporate the recommendations from the LGA document into some work we're already planning to do with the board. So I'll hand over to Jen and she'll take you through the paper and the recommendations at the end.
Thank you, Sarah. So as Sarah said, my name is Jennifer Taylor. I'm a lead commissioner in the public health team at the County Council. And I'll just take you through a summary of the paper that you've got in your agenda packs. So as Sarah says, that paper sets out the really stark focus on health inequalities that COVID-19 has brought because of its disproportionate impact on different populations within Gloucestershire, whether that's because of age, because of deprivation, geography, and the particular focus of this paper, which is on ethnicity. So board members will be aware of a number of national reports. Those are summarised, 2 of those are summarised in sections 3 and 4, which show that Black, Asian and minority ethnic groups are overrepresented both in hospitalisations and sadly in deaths from COVID-19 in the last 4 months. And PHE's report, which you have as an appendix to this paper, provides a descriptive summary of some of the factors that may be influencing that disproportionate impact. And it makes 7 recommendations that are really quite clear around what action needs to be taken, both at a national but really importantly at a local level to address those inequalities. So those 7 recommendations are set out in the paper, but they cover data collection and recording, participatory research with communities, access to and experience of health and care services, the risk assessment of our employees who are from a BAME background, culturally competent education and prevention activity, and culturally competent health promotion and disease prevention, and the broader and wider determinants of health that impact on people's ability to recover from COVID-19. So health and wellbeing partners have a really crucial role to play in responding to those recommendations, and I think the report also draws out the urgency of responding to those recommendations, particularly with the possibility of a second wave and the importance of putting in place action that prevents further impact should that happen. And section 6 of your report sets out a number of opportunities, as Sarah says, to use existing streams of work that the Health Wellbeing Board are already undertaking alongside individual organisational action to tackle inequalities. So some of those actions, and Sarah may want to go into a bit more detail on a couple of them, include producing this year's Director of Public Health annual report to make recommendations locally for tackling inequalities amongst BAME communities. The use of the developing Gloucestershire Prevention and Health Inequalities Framework with a particular focus on this area. Some of the strengths-based approaches to community engagement that we've identified through the Health Wellbeing strategy to really deliver some of that participatory research activity that's recommended, and system leadership of the Public Health England recommendations. And the report particularly identifies an opportunity that we were already discussing as a board earlier this year, where we may be able to collectively add value around taking an anchor institution approach, both to tackling inequalities, but also to contributing to Gloucestershire's economic recovery, in turn tackling that wider determinants of health recommendation by Public Health England. So the paper does set out a bit more information on anchor institutions. We have touched on it previously as a board earlier this year, but it sets out some of those opportunities that we may be able to seize by acting collectively as major employers in the local community, as purchasers within local supply chains, as holders of physical assets within Gloucestershire, and also, of course, partners in local communities and economies. So we have a number of opportunities there that will be able to contribute both to tackling health inequalities and the economic recovery of the county. So finally, the report sets out 3 recommendations towards the end in section 7. So those are to note the contents of this paper, but to support those opportunities that have been identified and the collective action that can be taken by the board. Secondly, to commit to further exploring that anchor institution approach and how it might be used as a vehicle to tackle our priorities. And if that is supported, to identify a small group of people to come together to further develop that. Sarah, do you have anything to add on the actions for Health Wellbeing Board?
Thanks, Jennifer. Just to add a bit more context to the first 2 bullet points in section 6. So I'm really pleased to be able to focus the DPH annual report this year on inequalities and Black and Asian minority ethnic communities. And we recognise that we were probably not best placed to talk about this, and so we've engaged the support of the Black Workers Network in GCC, and they're co-authoring the report with us. And so we really hope to have quite a large focus on some positive case studies in terms of the really great community work that's happened during the outbreak. And so I think co-authoring it will give the report hopefully much more insight and credibility for this particular part of our population. So I'm really pleased everybody to work with us in doing that. And with the second bullet point around development of the Prevention, Health and Policies Framework, this clearly has been paused for the last 4.5 months whilst my team have been involved in the response, and we continue to be involved in the response to COVID. But we have a plan to try and bring this back on track, and clearly it is really important that we have the inequalities framework that links the strategy and all the work going on in the integrated care system around tackling inequalities, that we have one clear framework to guide our work to tackle inequalities going forward. That's what I wanted to say. I wonder whether it's something to take questions. I can't see any hands up yet. I'm not quite sure if anyone's got any comments on that paper. I've got Mary, Councillor Richard Boyles, John McGinty and Chris Spencer. So if we go in that order.
Okay, thank you. I just want to say that I really welcome this paper. It's absolutely key and very timely, and we've started our thinking in the integrated care system around how we would focus on inequalities. We've already started thinking about work around areas we can actually tackle, producing an action plan, and also working with and understand how we can support staff, but also some work around a mentoring scheme. And we'd really welcome working on and getting behind an action plan that would really make a difference in Gloucestershire. So I really welcome this.
Thanks, Mary. I think we've just lost Richard Boyle, so I'll go next then to...
No, you've not
sorry.
lost me. I took my hand
Richard.
down after you'd seen it.
Oh, okay, so Richard, do you want to go next?
Yes,
I'm the
please.
novice driver at this WebEx approach, so bear with me, sorry.
Right, thank you very much. Good morning, everyone. It's Councillor Richard Boyles. I too welcome this paper, and I understand that you're trying to shape a strategic document for future work streams across the areas that are covered in the report. But I do feel, having read the beyond the data understanding the impacts of COVID-19, that whenever your report is read, that report should be signalled and sit beside it, because it contains the contextualised information that's necessary for people to further understand some of the points you're driving at, but without the detail in your more strategic document. It just gives more of a clarity to how people might read it. And I feel that is important, because some of the health effects that people suffer from across all our communities are driving some of the outcomes in poor health and deaths from COVID-19. And what we've got to do is make sure that we don't forget that strand in any document that we produce, so the public are clearly signalled to the fact that the way that they look after themselves, the way that they can help the health service to reduce the impact of COVID-19 is also a responsibility that the public have as well. That's just what I'd like to say. Thanks very much.
Thanks, Richard. Now, I wonder whether it's just timely to bring in Mary there, because I know that the Integrated Health System Executive and Board have considered this report in some detail. And I think one of the key recommendations of the report, and my understanding of it, was that there are things that we can do as part of the system to support people from the BAME community to reduce the number of deaths and the impact of any second wave that we would experience. So I think there's something about what we do as a system and then what we encourage the public to do as well. But Mary, I know you've had quite a lot of discussions about this, haven't you?
Yes, we have started just working through the data, and we've identified where there are particular issues. So there's more work to do on that. So we hope to have that work completed, working with your team, Sarah, as well, in the next month. And we've given ourselves until October to produce a more detailed action plan, but there'll be a whole number of strands to the action plan. We've particularly started the work already on respiratory, because we understand that will be a definite strand where there will be significant impact following the impact of COVID on individuals, and we need to understand how we improve our rehabilitation offer, particularly for people who've been impacted by COVID. So all of that work is underway now, and we hope to have something more clearly laid out by October or earlier if possible, starting with a more detailed analysis of the data and then some review of the service offer we can provide in relation to that data.
Thanks, Mary.
Can I just come back there, Sarah?
Of course.
With the current situation where you don't get to see a doctor face to face, if that's going to continue through into next year, how are we going to address some of the issues that doctors might need to address with patients who are presenting to them with underlying health conditions that they might need to see more than just hear over the phone? I'm just trying to get a feel for how the health service are going to manage public health going forward in this virtual environment, and what doctors think about the need to actually see patients physically and advise them rather than talk to them over a phone. Thank you.
Probably start, but Andy would be good to answer this one, I think, if Andy's...
Yeah, sorry, I did have a hand up. I'm not sure it was seen. And I'd also probably ask Teresa Pietroni to comment for the board's information. Teresa's just joined us as the new GP representative, as one of the primary care network clinical directors. And Teresa's in a city, Gloucester GP, and a lot of her patients are from this background. So I'm sure Teresa will have a comment. I just wanted to comment that on Councillor Boyle's last comment on the face-to-face issue with the primary care. GPs are seeing patients face-to-face when it's appropriate. So I don't want to give the impression that GPs aren't seeing patients. It's a lot of consultations are taking place over the phone, but where necessary, patients are being brought in under safe environments.
Thanks, Andy. Teresa, do you want to comment further?
Yeah, sorry, I can't work out how to put a hand up other than waving. Just to give you some data, 16 patient contacts a session for me on average, of whom 4 or 5 are face-to-face. Did I hear?
I think we
did that
heard,
get across? So we're actually
I think you broke up a little bit. I think we heard 16 patients in the session and 5 or 6 of those are face-to-face. Is that correct?
That's correct. We're actually doing a fair bit of face-to-face work. The difference is that doctors and patients together are deciding whether there's a need to be face-to-face or not. I think there's a feeling out there that we're not doing any. We're just doing it on the phone. That's actually not the case. So I support what Andy says there. And to add to that, thinking particularly of the BAME community, when there's a language problem with translator, it's got to be done face-to-face. So we're certainly bringing patients in where translators are required, even when the problem could be dealt with over the phone.
Thank you. Richard, does that answer your question?
That's great. My understanding was that there was significantly less volume of face-to-face, but that's actually very reassuring. Thank you very much.
Right, thank you. So I've still got John McGinty and then Chris, and Andy and Mary's hands are still up. So I'll assume if your hands are up and you have another question. If we go to John McGinty next.
Thank you, Chair. So I was just going to say broadly that we welcome this report and that Gloucester City Council would like to join the working group if it's possible to nominate Anna Brinkoff. We'd like to put her name forward. I think there's a lot of sort of things, stars aligning on this. Our Gloucester ILP has decided to focus on inequalities. And our City Council just last week, full council passed a motion to set up a Race Equality Commission, which hopefully could work alongside this working group and sort of help shine a light on inequalities and how we tackle those. So you'll probably be written to. A number of people around the table are going to be written to by Gloucester City Council soon, asking you if you're willing to join a Race Equality Commission for the city. I suppose the only other point I was just going to make was I think there's a number of anchor institutions actually within our BAME communities. I just think the paper doesn't quite draw that out enough, and about whether or not some of those people from those institutions could actually join this working group as well, because I think they could really help us design culturally competent risk assessment tools and prevention campaigns and things like that. So I suppose, as well as nominating Anna Brinkoff for the working group, could I also ask that some of our anchor institutions within our BAME communities are invited to join that working group as well, please? Thank you.
Thanks, John. We welcome Anna's input to the working group. Thank you for being the first to nominate. And I think you make a really helpful suggestion. We can't do this on our own. We are a completely white British Health and Wellbeing Board. We can't design something for the community when we don't involve the community in that design and that development. It would be entirely inappropriate. So I think if you've got any ideas in terms of who the BAME anchor institutions would be, I think Jennifer would really welcome those. Thank you. Okay, so I think I've got Chris Spencer and Wayne next. Chris,
okay, thanks, Sarah. One of the problems with Andrea being so efficient is that you read the papers when they come out and make notes, and then you forget what the essence of the point was that you wanted to make. But going from my notes, I did make a few comments here about the report, which I think is a great report. But I think where it's a little bit short is that it doesn't make enough of our power base around power and influence as purchasers. you know, we are huge institutions. I won't call us anchor institutions because I don't like the metaphor either, because an anchor is designed to stop us going anywhere. So that's probably a public health term that has been created. But I think what it does need to make more of is that power and influence that we have through purchasing goods and services to affect those that work with us or we purchase services from. There is a section on procurement and commissioning, and where we talk about NHS alone purchasing power being in the region of 30 billion. That's hugely significant, even in local terms. And if you add to that the other partners to the board, then that's massively significant. So I think it could make a little bit more about influencing matters beyond the boundaries of our own demise, really, is what I'm saying. But otherwise, a great paper. Well done.
Thanks, Chris. Jen, do you want to comment at all?
Yeah, sure. So we did talk a little bit about anchor institutions earlier in this year, and it's I think it's an international term. I think it's a term that comes from America originally, but I take your point, Chris, about the implication of it. I think really what that concept is about the role that we play as organisations that kind of aren't going anywhere, because we're naturally tied to Gloucestershire. We are. We're not moving location, and our interest is in the Gloucestershire community and Gloucestershire residents and Gloucestershire business. And I think you're absolutely right, Chris. I think there's something about us really understanding the power that we have, both as employers. So the healthcare and public sector in 2015, I think it was, employ a quarter of Gloucestershire's working population. We have significant purchasing power, both from kind of business supply chains, but also services, and our ability. So there are areas like Cheshire West, I think, who have really thought about their health and care supply chain and really thought about both how they procure at a local level and really invest their spend in their local communities. To help create a kind of vibrant economy, but also to really put their money where their mouth is around social value as well. So that kind of added value from their purchasing power in a local area. So what else are they getting for their money? And clearly we've got responsibilities around the Social Value Act, but how do we really make that work and really use it as a catalyst for the local economy? So I certainly think that's something that we could really better understand as a local group of organisations, whether we want to call them anchor institutions or not, and to really identify how we might be able to extend our influence that we've already got, and use that proactively to tackle inequalities in our community.
Thank you.
Thanks, Jen. Thanks, Chris, for a great question. I've got Wayne, then Nikki, then Darren. So Wayne, would you like to go ahead with your question?
Yes, thank you, Sarah. First and foremost, I'll follow John McGinty by saying I'd very much welcome Mark Priest's involvement from Community Safety Directorate and the Fire and Rescue perspective on the working group. And then secondly, I suppose it's more of a challenge to the board effectively, in that welcome the paper very much, and particularly the focus on COVID-19 related health inequalities. But I do think the paper in some areas infers a slightly broader view around inequality, which is good. The conversation we're having today infers as well that we're considering broader focus on inequality. And I wonder, because of the large power base and the number of organisations represented around this table, whether we can almost add an additional action to that paper where there's an opportunity to bring us together in a systems leadership perspective to look at inclusion across Gloucestershire, whether it be through Leadership Gloucestershire. John's mentioned things like the Race Equality Council from the City Council. Certainly as a county council, we're doing work, and as a fire and rescue service, we're doing some specific work. I know Gloucestershire Constabulary are doing some work from conversations we've had recently. All of us will be doing some work around inequality or inclusion. And rather than maintain the focus on COVID-19, is there an opportunity, in addition to that specific health-related work, for us to look at a broader inclusion agenda from a systems leadership perspective right across Gloucestershire to develop this piece? It's very topical at the minute, and you know, if we're brutally honest, the country has a long way to go, regardless of where we are in Gloucestershire. And I think there's a reasonable challenge for us to step up and mobilise some real effort behind this at a high strategic level that cascades down into a number of organisations where we can provide some mutual support and make some real progress.
Thanks, Wayne. I think that's a really helpful suggestion. I'd just like to bring Jennifer back into her view. She's also leading this piece of work.
Sorry, I wasn't able to unmute there. Yes, I think that's a really helpful suggestion, and I was just taking some notes while you were talking, Wayne, about potentially how we structure this, because I think there are two strands, but they're very closely interlinked, aren't they? So there's that kind of power of the Health and Wellbeing Board organisations in supporting the local economy and tackling inequalities, and there's almost that strand as employers and service providers, where our system leadership of the inclusion agenda are really important. So actually we lead by example with both our staff and our service users, clients, customers, whatever role we play in that system. So I think I'm just taking some notes about how we might be able to structure that, but I think we can come up with something that really draws those two strands together, but is clear about both of them as being really important roles. And I think certainly where I think we were hoping to get with this paper, and it feels like we're getting there, was around what is the added value that the Health Wellbeing Board brings to this agenda. So clearly as individual organisations we're going to be doing different things, but what's that collective power that by having everybody around this table, this virtual table admittedly, what's the added value that we bring to this agenda? So thank you, and that's really helpful.
Thanks, Jen. So I've got Nikki from Health Watch next, and Darren from the Cheltenham Borough Council.
Good morning, everyone. Just to start off by saying Health Watch absolutely welcome this paper, and we'll do our very best to support it from our perspective. Our experience is it's been very, very difficult to connect with the BAME communities, and although I think organisations do need to continue to do what they're doing, the power of this approach, bringing organisations together across the system, we can learn from each other, we can share experiences, and I suspect from the conversations I've had with my friends from these communities, the fact that so much is coming in different directions kind of drives them a bit nuts. So if we can think that through and approach in a sensible and less intensive way, I think there'll be huge benefits in that. And just to flag up, I mean, this is a really important group of people. There are other very important groups of people who also suffer from health inequalities, and we mustn't lose sight of that.
Thanks, Nikki. And just to reassure you that I think the broader inequalities agenda was picked up underneath the health and wellbeing strategy that we'll look at later on in the agenda. So I completely agree. That's really helpful. Thank you. So I think that just brings us to Darren. That's the last hand up, I think.
Yeah, just one very quick point for me, really. We've talked about social value, which is a really important area for many organisations. I suppose as an action, do we all have a social value policy? So does every organisation at the board have one? And within those social value policies, are our objectives in terms of where we want to focus social value, are they aligned? So we've talked about systems working, systems leadership, and that alignment. So I think we'd probably be sensible to take an action away to do we have a policy across the table, and do we have alignment in terms of our objectives of where we want to leverage value?
Okay. Thanks, Darren. Sorry, I'm trying to drive the WebEx, read the comments, and listen, and I'm probably failing at all three. So I think you suggested a really helpful action then. So I think what I've heard and read on the comments are that, starting backwards, that the comment about the social value policy and do they align is a really powerful one. I think there's an action we can all take away there for our respective organisations to check we've got a social value policy. And then I think that maybe there's some work to do to see how they align. And I don't know whether that would fall linking to the group, the short life group that Jennifer's putting together. She's nodding. But I think first of all, as an action, if you could inform Andrew in the next 2 weeks if you've got a social value policy, and perhaps send her a link to it, that would be hugely helpful. And then I think we had some reflections from Health Watch in terms of they found it difficult to engage with the BAME community, which isn't actually one community, it's lots and lots of different communities that are all very different and vibrant in their own respects. That in itself presents us with a challenge, but an opportunity to link in with a number of different communities to inform this work. There's a point from Chris around how we might use our power and influence as anchor institutions for the greater good, and I think that is inferred in Jen's work, but we probably didn't bring it out as much as we could on the paper. There was something, Wayne's point was around consideration of a broader inclusion agenda, and I think there was support for that in embedding that in the work. And then also to include BAME anchor institutions in this work, which seems eminently sensible, and John was going to forward any suggestions to Jennifer. We've had the Anna Brinkhoff's been volunteered, Mark Priest has been volunteered from the fire service, and also Cheltenham volunteered someone. And David from the LEP has said they very much welcome this paper and the emphasis on anchor institutions, and it chimes well with the local industrial strategy and the economic recovery plan, and they're also happy to engage in a subgroup. So I think, Jen, you've got 4 willing volunteers there to work with you, which feels really helpful. And I wonder then if we could perhaps receive an update at our next meeting in September. This feels like really important, urgent work at the moment. I'm hoping that summarises our discussion. I'm sorry, Carol, for slightly treading on your chair's toes there. Very different being involved in virtual meetings, isn't it?
I'm very happy for you to do what you're doing. That's eminently sensible.
And also we've had a volunteer from the ICS as well, from Mary. So I think that's really helpful, isn't it? Thank you. So we'll be in touch.
I think I do thank Jenny for the paper, and Sarah, your input as well. I think one of the things we mustn't lose sight of is that this work is very time sensitive. We really need to get on with it. So it would be helpful, Jenny, if when you get yourself organised in terms of either the scope of the group that's going to work together initially, or it would be helpful to share that information with the rest of us so we can have input. Thank you.
Thank you, Carol. We'll keep you briefed.
That would be very good. I'm looking for September for some feedback, if not before. Right. I'm trying to keep to it. Is there anything else I want to know? Okay. Moving on to item 10. This is the local outbreak management plan. Oh, I need to go back a bit, really. I need to just check if the board are comfortable with all of the recommendations. We've focused particularly on the one, which is about setting up the group. Can I just get agreement that everyone else is happy with the rest of it, which is to note the opportunities for local action, including those which are already underway, to commit to developing an anchor institution approach to addressing the 7 PHE recommendations. And the last one, which we've just discussed at some length, is to have a representative small working group. I'm going to assume there's general agreement unless there's other. Okay, that's fine. Sorry, I'm going backwards and forwards, but I'm struggling with a pack. Okay, back to the agenda. We're now looking at item 10 on the agenda, which is the local outbreak management plan, which I love the initials, LOMP. That has entered my vocabulary now, and I'm boring everybody with it to a point where they now ask what it is. So everybody that I know knows what a LOMP is. And I've got a children's group drawing it, which I shall share with you when I have the opportunity. So Siobhan, I think, is going to present this paper to us.
Hi,
Hi everybody. I tend to have problems with WebEx. If you lose me, please stay, and I will take the video off. I apologise. Bear with me a second. Hello, can everybody hear me again now?
That's better.
I'm so sorry. Every time I take my video, every time I speak on WebEx and I have my video on, this happens. So I apologise. You now can't see me. You know I'm here. So yeah, I'll go ahead and present the paper. Thank you. As Carol's helpfully outlined, this is the LUMP, or GLOMP if you want to put Gloucestershire in front of it, which stands for Gloucestershire Local Outbreak Management Plan. This is a national requirement that was announced at the start of June, that all local authorities will need to produce a local outbreak management plan that will outline their ability and strategy to respond in outbreaks. As outlined in the paper, there's 7 key themes in there, which are really looking at particularly high-risk places, which might be, for example, supported housing locations, care homes, schools, and possibly if we had something like a prison, but obviously we don't in Gloucestershire. So it's looking at those areas where outbreaks might spread quickly. I think even since the paper has been published and the national request has come down, we're still identifying new high-risk places. So there's been a lot of focus nationally on places like meat factories and areas of, for example, the fruit farm in Herefordshire. We've got some learning from there about how workers congregate and outbreak might happen in those sort of settings. So it is evolving as we speak. And the other parts, the other themes that need to be included are around testing and contact tracing, and how we will work with the National Joint Biosecurity Centre to interpret the data that they will produce and take appropriate action locally, and also support our vulnerable communities. And then, most importantly, how we'll look to establish governance structures to make sure that this works properly and effectively for the people of Gloucestershire. So that's the 7 key themes. We've written the plan, it's available online and has been around now since the 30th of July. But just because it's published doesn't mean that that's the end of the document, and it's going to be on a revolving 3-monthly review. And the 4 major areas that are covered in it are prevention, that's absolutely about us needing to reinforce the national messages on social distancing, hand washing, and clearly in the coming weeks, wearing of masks in public spaces such as shops, and also ensuring that any other precautionary mechanisms are in place. So, for example, COVID safe workplaces are really important. So we're working with our environmental health officer colleagues who are doing sort of spot checks and supporting of the local businesses to make sure that the regulations being followed to the letter of the guidance. So that's really helpful around prevention. Then the second area is around containment. And the most important thing that people can do if they've got COVID-19 symptoms is to self-isolate and to ensure that anybody that's been in contact with them also self-isolates. Sarah's said a few times that it's people that spread the disease and not places. So actually we need to make sure we work with our citizens to help them understand that they do need to take responsibility to isolate themselves and stop passing the infection on, but recognising that some of our community might need more help to do that in those situations. So the contain element is about making sure we can support people to understand the information and then self-isolate when they need to do so. And a big element of that is around testing. And you'll know that we've done a lot of work around making sure we've got mobile units across the county, which are moving around to ensure accessibility, and also around the regional testing sites. The next element is on response, which is when there is unfortunately outbreaks of disease, which at the moment are infrequent, but could potentially become more common as we've seen in other parts of the country. The plan sets out how we will respond, and that's the main principles of a health protection response, which are forming an incident or outbreak management team to discuss the situation, put in appropriate control measures, and support the public with key messages and communication strategies. And then finally, the last element of the plan is around monitoring and data sharing. And that recognises that in order to respond effectively and quickly, we need to understand what the local data is telling us and how and where our cases might be appearing so that we can intervene in a timely manner. And there's also something about transparency of data to the public. And again, you'll have all been seeing in the news in recent weeks the changes that have been happening around the data that we have available to us at local authorities. And as of yesterday, we got an announcement that we'll get full test and trace data on individuals in the local authority area so that we can really support the other elements of our plan. So that's fantastic news. The final bit of the paper just outlines the governance structures that we've put in place. So there always has been a health protection board in Gloucestershire, which is been chaired by Sarah as the Director of Public Health, and that oversaw a wide variety of health protection issues ranging from immunisation right the way through to infection prevention control aspects, things like our e-book programme in schools, and including things like tuberculosis outbreaks or episodes of meningitis, etc. in the county. So that repurposed so it has that broad function, but also a very specific function now looking at COVID-19 over the next 6 months to 18 months time frame. And that's supported by an operational group, which is just establishing that the Health Protection Board will be able to task to do the work that needs to come out of the oversight of the plan. And this obviously links back to the Local Resilience Forum and the Strategic Coordination Group, which was chaired by Sarah until the end of June when it passed back to the police, because they've recognised that they've moved into more of a response phase, that Sarah, as chair of the Health Protection Board, will continue to, they've moved into a recovery phase, and Sarah will continue to look at the response aspects of the outbreak management plan. And then the final aspect is around the COVID-19 engagement board, outbreak engagement board, and that's cross-party, chaired by Mark Hawthorne as the leader of the council. The role of that group is to ensure that we think about how we engage with our public and our members. And it's not about scrutiny, but how taking advice from the experts in our local communities on how to best engage. And I think it links back to the discussion we've just had on health inequalities and the AME issues, for example. How do we best engage those members of our communities so that they understand, accept and cooperate with the messages we need them to around containing and controlling outbreaks. So I think that's the summary of the paper. Happy to take any questions. Clearly, you'll know that there's been a £2.2 million grant attached to that, and we can give some more detail on how that will be spent if needed. But I think it is important to emphasise that things evolve daily, and we're constantly reviewing both the online plan and the operational plans that sit underneath it to give assurance to the Health and Wellbeing Board that this is very much a live issue.
Thanks, Siobhan. And we were certainly using the plan all weekend. So yes, it's certainly not anything that's going to sit on a shelf and gather dust, and we can assure you of that. So I've got Darren. I don't know if Darren, your hand is up from the last question or whether you have a new question. Then Tim, and then John McGinty.
I will take my hand down. Apologies.
That's okay, don't worry. So that takes us then to Tim Harman then, please.
Can you hear me? Good morning again. Yes, first of all, I'd just like to give my thanks to Sarah and Siobhan for the amount of work that's gone into this, and for the role I have as Public Health Cabinet member. I've seen a great deal of work going on, really good stuff, and the whole team, so thank you for this. A few comments on them. It does occur to me that we've identified a lot of the areas where it is likely that we may get outbreaks. I have a suspicion that things may obviously occasionally approach us from left field. That nobody can anticipate, and obviously having a fast response is good. Some of you may be aware that we took part in a sort of dummy exercise a couple of weeks ago with specialists from across the whole range in the county when we did role play, an event which actually fictionally took place in my own division and very close to where I live, so it was rather very, very close to home. But it did seem from that, with the flexibility and commitment of all people, that I would have confidence that we could respond to the situations as it arrived. But my suspicion is it may come unexpectedly if it comes at all, and we need to be ready to deal with it. I think the funding from government, 2.2 million, is very welcome. and also as a member myself of that engagement board, which Siobhan mentioned, you know, we will be making sure that members at both district and county level and others that need to be involved are covered and take part and fully understand the process that's going on. Thank you.
Thanks, Tim, and thank you. We'll pass on your thanks to the team. So that's really helpful. Thank you. In terms of then, I think the questions that we've got, John next.
Thank you, Chair. I was just thinking, whilst reading the plan again, about the links to the previous agenda item about anchor institutions and the connection to the engagement board, and I just wondered whether maybe we need to ask that working group as one of their actions to look at the EAME anchor institutions or anchor institution membership of that engagement board and connection with. Just strikes me there's an overlap between the two agenda items we've just been discussing. Thank you.
Thanks, John. That was raised at the first meeting of the engagement board. So we have a range of elected members across party, district and county, which is really helpful. The parish and town councils are there, voluntary and community sector. Nikki's there from Health Watch, Care Providers Association, the LEP and Young Gloucestershire. Not everyone could make the meeting, unfortunately, but I think we had, and the Police and Crime Commission, sorry, Martin. We had really good representation, I think, for a meeting from relatively short notice. But we did recognise that that was a gap. I think one of the actions I took away was to contact members of the engagement board to see whether we could find a single representative of the BAME community, which is going to be quite difficult, or an organisation that could represent them sit on the engagement board, or whether someone like the VCS Alliance or the districts through their links into their communities would be better providing that link. And just, I suppose, just as an example of how we're trying to engage with the BAME community, we've been doing some work to understand how we might put out some messages around Eid, which is next week. And I think we've had some feedback that certainly some members of the Muslim community, because of what's happened in Leicester and Burnley and Blackburn with Darwin, do feel slightly victimised in the press because of the perception that they're not complying with messages. So we want to try and deliver messages around safe social gathering during Eid that's going to be acceptable and heard by the community. So it's just another small example of how we're trying to do that. And we've used our existing contacts into that community and some of our own staff and members of the community as well. But I think you're right, and it is an action that we are pursuing. I haven't got any more questions. I'm conscious that some of you might have had 3 or 4 briefings on the LOMP in various meetings in the last 7 weeks. It's certainly become a very prominent piece of work for Siobhan and I, and will continue to be the work that the document that guides our work probably for the next year. I think the recommendation, Chair, was to note the report. If no one has any further questions or comments.
Yes, thank you. The recommendation is to note the contents of the local outbreak management plan and to ensure your organisation is engaged as appropriate. So I think there's a need for feedback. There's a need to actually be more action centred, to actually go and seek people out and find out what their views are, and see where we go for there. And I particularly am interested in Tim's comment about stuff hitting us from left field. We're very COVID centred, focused, but that's not to say that's the only thing on the horizon that might actually turn up during the winter period. So I think we need to be very alert and very aware of what's going on and move with a pace to actually make our people safer. So thank you very much, Siobhan, for your presentation. I'm sorry we couldn't see you, but you came over loud and clear. Thank you. Right, we're moving through the agenda at a pace. We're now going to look at item 11 on the agenda, which is an agreement of the Gloucestershire Health and Wellbeing Strategy, pages 147 to 170. This is a significant piece of work that's been around for a long time. It's had several reiterations and it's had lots of discussion, and lots of people have actually informed the report. So I'd now invite Sarah to actually cover what we have in the pack. Thank you.
Thank you, Chair. So this feels like it's been a bit of a labour of love for me for the last, I think it's been 2 years and 3 months since we started this process. So I'm aware we've got quite a few new members of the board, so just going to give you a bit of a recap. So back in, I think in 2017, we had an LGA peer review, which gave us some really, really helpful insight into the prevention work across our system and the work of the Health and Wellbeing Board. And 5 of the 9 recommendations relate to how the board work and the production of a new health and wellbeing strategy. We've implemented the actions with respect to the board, and I think that is a testament to how we're functioning today. But they suggested that we needed a strategy that was much more informed by what the community felt the health and wellbeing priorities were for the population rather than what the data told us. So we started a process of quite a significant process of community engagement to understand what was important to communities. And that process is summarised in the strategy itself. And we also, of course, looked at the data and intelligence that we had to understand what was impacting on our communities and what was making people ill. And some board members might remember a very, very focused 2-hour session we had in the Cabinet Suite, I think last January, to prioritise. I think we only came to our priorities with about 90 seconds to go on that 2 hours, but we had a very lively debate for 2 hours. And we ended up coming up with 7 priorities, which is a few more than we wanted, but we ended up with the 7. So I suppose my point in raising this is that since then we've had quite a few suggestions for other priorities. But the priorities we've got in there are the ones that the community told us were important, or the data really strongly alluded to the fact that this was something impacting on our population. We also decided on one of the guiding principles of our board that we would only act where we would add value. If an organisation could hold or deliver on a priority on its own, we wouldn't focus on that. Where we want to focus where collectively we can have the biggest impact by coming together and working together as a board. And we also acknowledge that there were some areas that were important priorities, that the system priorities that we just couldn't prioritise. We had to draw the line somewhere because of the limited capacity of our respective teams. So you'll note from the paper that we agreed a vision that Gloucestershire is a place where everyone can live well, be healthy and thrive. Again, that took us a couple of sessions to get right, and we were all agreed on that. We recognised the importance of other system-wide priorities and documents, for example, Vision 2050, the integrated care system and its approach to driving improvements in quality and health outcomes across the health and care system, the NHS long-term plan and its role in that. So we came up with 7 priorities. They were physical activity, adverse childhood experiences, mental wellbeing, social isolation and loneliness that we're sharing with the Safer Gloucestershire group, healthy lifestyles with an initial focus on healthy weight, the best start in life and housing. And throughout the report, there was a golden thread of tackling inequalities, because inequalities is embedded and would underpin all of the 7 priorities. We also noted 4 other areas that we felt were important, but basically didn't make it above the line for the 7 priorities that we agreed, because we had to draw a line somewhere. But we recognise they're important, and if when we're reviewing our progress throughout delivering the strategy, we get to the point where perhaps one of the priorities has become business as usual, and we're confident we can take forward that priority and still deliver improvements, and perhaps we can interchange one of these 4 for the Health and Wellbeing Board priorities. So they were noted as climate change, transport, green infrastructure and economic development. And because of their importance and interconnection with the 7 priorities, we said we would look to produce a short summary of why they're important and what we're currently doing about them, because there's still system-wide work to progress these issues, but we're not necessarily using them as a focus for the board. So what you have in front of you today is the Health and Wellbeing Strategy. I think those of you, we've responded to all the comments we've had. It's the Word version, so once agreed, it will go back to the designers and will look slightly more attractive to read, and I hope will encourage members of the public and other stakeholders to read it. It is very much the beginning of a process. I think we've tried to make this as perfect as we can, but all the while we continue to deliberate the strategy document, we're not necessarily coordinating activity to tackle inequalities, we're not delivering it. So I think myself and Carol would like to recommend to you that we sign off the strategy today, because then I think we need to have a discussion about the leads identified in the paper and how we propose to take forward the work to start to develop the action plans, to understand what metrics we can use to measure any progress against our priorities and start to have an impact for the population of Gloucestershire. So I'll leave it there. I'm happy to take any questions. I can see Chris has got his hand up. I can go first to Chris Spencer.
Thanks, Sarah. Look, you know, we've debated this endlessly, haven't we? And I think this is a good strategy, and I'm not for revising it. But like any strategy, it has its roots in the time and place that it was devised, and this was pre-COVID. I still think it's appropriate. I'm not saying it isn't, but the advent of COVID-19 has changed the landscape somewhat, and therefore maybe the emphasis, not a change in priorities, but an emphasis on the priorities might be called for in some kind of subsequent paper. And I've got in mind specifically mental health. I think mental health has taken a real dive in terms of prevalence and in terms of our ability as partners to deal with what we're encountering on a day-to-day basis out there. And I for one, as Director of Children's Services, am experiencing huge difficulties around the number of complex young people presenting with mental health problems. And I know others do, because I'm getting letters almost on a weekly basis. The latest one from Gloucester Hospital saying that they had a half a dozen complex young people on a children's ward that they just cannot cope with. 2 of them were from Herefordshire, actually. They weren't even ours. But mental health is impacting. That's just one example of how it's impacting. And it just leads me to wonder whether, you know, if this is an evolving and an organic strategy and not a single point in time, then we probably need to kind of consider how the context is evolving under current circumstances. And that's one area. I'm sure others could think of others where situational circumstances have changed, and I think we need to give some attention to.
Thanks, Chris. And I think we have tried to reflect the impact of COVID in the document. But I think I do take your point absolutely about mental health, but until we start to develop that mental health action plan, we're not actually going to be doing anything constructive. And we're still working on mental health. So, you know, we've got our integrated commissioning function working really closely on adult and children's mental health with my team at the moment. But I suppose it's just, do we not approve the strategy now to amend it further? Or do we say, for example, you know, Angela Potter's very kindly agreed to be the board lead for public mental health. Do we ask Angela to go away and do some thinking with the team she could pull together around what else might we need to do in response to COVID? Because I think we need to be more focused on action and actually starting to do some things in the system rather than going back and reflecting on the words of the strategy. But I'd happily take another view.
Yeah, I'm not suggesting we don't sign it off. I think we should sign it off. But I just think, you know, to treat it as an evolving organic tool that raises issues and that we respond to in real time, as opposed to kind of set some objectives at the start of a year and stick to them until the end of that year and the beginning of a new one when we set other priorities. I just think we can be a bit more kind of flexible and agile than that. That's what I'm calling for, really. I know you're not saying that, but that's a concern.
I misunderstood slightly. So I agree completely. And I think also the adverse childhood experiences priority would also play into that as well, as with some of the work that Andy's going to present next with Dame Janet. So I think it has to be responsive and iterative, doesn't it, to what our system is facing. So absolutely agree. Okay. So the next person I had then was Darren.
Hello, yeah, I just want to echo the point about priorities and that we need to make sure we maintain that discipline over priority setting and we don't have priority scope creep. Because we do recognise that below this board and below, say, Gloucestershire, there's quite a lot of groups and initiatives set up below those 2 boards. And we need to make sure that we are mindful of their resources as well. In terms of the document itself, I think we should approve it today. I also think we have to accept that I don't expect us to get perfection. I think we've got a document now that sets out a direction travel of where we want to get to based on data and the community request. I think what we need to do now has the urgency behind it now to deliver the tangible action plan, and the action plan monitoring then becomes the one of the actions then for the board to oversee to make sure that it is still on track and it's relevant. And so from Cheltenham's perspective, I think we need to approve it, and I think we need to make sure we'll do whatever we can then to help support the action plan development.
Thanks, Darren. That's really helpful. Okay, I think now I've got Mary and then Angela.
Okay, so can you hear me now? Okay, so my comment is really, in reading through this report again, I was just struck by the where the paper highlights the variation in populations across Gloucestershire. So one size doesn't fit all. And also I was just reflecting, as Chris has said, on the impact of COVID on the priorities and how we need to reflect that into our action plans. And as well, I was thinking around inequalities. So we may need to think carefully about the resources we deploy and understand how we prioritise those. So for each of the leads, as we start to put together our action plans, we need to really bring those factors to play more into this planning. And of course, we have, of course, the system got the ILPs who have got already set some plans and beginning to work again with partners across the system. We have been doing across the whole system a big piece of work on volunteering, and that's going to be led by the BCS Alliance and all of our behalves. And so we can try and see how we can bring this together with some of these priorities to give ourselves an action plan. I am concerned about resources, both management resources and physical resources, as we set out our plans, because there are a lot of new priorities due to COVID and other issues in our system now. So I think the leads have got to be really careful when we put together a plan to actually ensure that there are key parts of that plan focused on place and focused on key priorities to ensure we actually deliver something in this year against this plan.
Thanks, Mary. I think they're really good points, and I'll sum up at the end, but I absolutely agree. And I think a lot of the work we've done up until COVID was around ensuring there was some synergy between these priorities and when we were supporting the integrated locality partnerships to ensure we weren't inventing a new set of priorities at a more local level. So I think it was beginning to mesh together, wasn't it, up until about February, and then we'll begin to pick that work up. Hopefully we'll see that that's still there. So thanks, Mary. I've got Andrew and then Simon.
Thanks, Sarah. So from my perspective, obviously I'm one of the new members to the Health and Wellbeing Board, and Sarah and we've had an email exchange prior to the meeting for me to understand a little bit about the gestation of this document, and really it's to reiterate and support the conversations that have already happened. In that I do agree we should be signing the document off now. I'm more than happy to support that and to work through the nuances of the changing landscape, and particularly, as we say, the mental health impact that's had on a much broader range of our population than we would have ever envisaged that it would have, in terms of the way in which mental health and ill health in terms of COVID are now a priority for a lot of people. So happy to support the strategy and to take the framework forward in terms of how we think about mental health, both in terms of the priorities that were identified before and the impact that COVID's now had on our population.
Thanks, Angela. That's really helpful. Really helpful. I'm scanning comments and looking at hands as well. I just had a comment from our new Assistant Chief Constable, Rihanna Kirk, who said that I think she is she's yet to be confirmed as the board lead for adverse challenging experiences. I thought it had been confirmed. I think we were inheriting a really great project that's got probably one of the most advanced of the board, so you'll be in a good position there. But signing off the strategy, which she used to leave in a minute. So welcome to the first board. Nice to meet you virtually. I'm happy to have a chat about ACEs at some point. And so Martin isn't able to raise his hand, but if I go to Simon and then I'll go to Martin and Simon, if you'd like to go first.
Yeah, thanks, Sarah. Just a quick question. What's the process for agreeing the metrics? So there's some in section 9, there's 4 of the 7 areas. But I just wondered, when the teams have done some work, are those final metrics going to come back to this board for sign off so we can agree what we want to get out of it?
So in discussion with Carol before the meeting, we had a suggestion for an action for all the board owners of the priorities, and I can outline that action now if that's helpful. The suggestion was that as Health and Wellbeing Board members who have a responsibility for one of the priorities, we would do some work in the next 8 weeks with the teams we would be working with on our respective priorities. And really that was around scoping out, well, and bringing back a report that the board member would present next time in September. And that would be looking at, well, do you have a group already in place to take forward your policy? Do you have a plan or a strategy? Or do you need to develop one? What indicators or metrics would you need to, or are you suggesting that would work for measuring your impact on your priority? And what's your plan for taking this forward in the next 12 months? So we're asking the board member to take responsibility for that, which would allow us to take into consideration the point Chris made about what's changed since COVID and how might we want to take the priorities in a different direction, or perhaps, as Angela said, the target group might have widened because of COVID in respect of mental health. But then it gives the board some assurance and some ownership from the board member that we're going to drive forward this priority in the next year. That was the suggested action for, I think, the 7 of us that are priority leads. And then we would have a say on the metrics, and we would then obviously bring them into one dashboard, and we'll bring them back frequently to the board so we could gauge any impact of the work that we're doing on the priorities that I identified. So, Martin, you had a question.
Yeah, it's a comment really. Thank you, Sarah. I actually do endorse what Chris Spencer said about the delivery and the importance to focus on some key areas, and that's important. Also, I do support the strategy. I think there's merit in considering this paper with the next paper as well, the child-friendly Gloucestershire paper. I think they are linked and need to be linked. I think it's important that the work of this strategy and the child-friendly Gloucestershire really go hand in glove. They are trying to achieve many of the same aims. So I think it's important that child-friendly Gloucestershire is recognised within the strategy and endorsed by the board. I think it already has been, but just formalising that to make sure that child-friendly Gloucestershire is a delivery method which this board supports, and it goes hand in hand with this strategy. But we'll come on to that paper shortly, and I think that's important. Thank you.
Thanks, Martin. And the board has in the past endorsed the child-friendly approach and its relationship to the strategy. I think it very much sees it as part of the delivery mechanism for the best start in life priority. So that we've already done that in previous meetings, but so that is something we've committed to.
Thank you.
Okay. So if there are no other questions, if I try and sum up what I think I've heard is that I think everyone's supportive of signing off the strategy today. We need to recognise the impact of COVID and how that might have changed or had an impact on the priorities of the groups that might be affected by some of those priorities. We need to be careful about priority scope creep, because recognising that we had a finite resource before COVID, and certainly now we are stretched more thinly. Think more about resources and tackling inequalities, and as Mary said, a number of pieces of work and train. And I think we've said in the past that we can't have a county-wide response. We need to have something that's much more nuanced, that has a bit more of a local footprint. And the ILPs working in that district council type of footprint was a much more helpful geography to work in, because we can get much closer to communities and have a different approach, and it's much more targeted. And I think I've captured everything. And then obviously Martin's final point about the link to child-friendly, and they are linked, and hopefully Andy and Janet will make that point in their paper that's coming next. So hopefully I've captured everything. And then finally, there was the action for the 7 of us that are leads. So just in case you've forgotten, I'll just remind you. So Andy Seymour is the lead for physical activity. Rhiannon Kirk, who's just left us, the new Assistant Chief Constable for Gloucestershire Constabulary, is the lead for adverse child experiences, taking everything Julian Moss. Mental Wellbeing is Angela Potter from Gloucestershire Health and Care. Social isolation and loneliness is shared between Mary Hutton and Chris Briley. I Need for Healthy Lifestyles. Andy Dempsey, although not technically a board member, I think as Chris Spencer delegated this to him, but he's Director of Partnerships and Strategy for Children's Services in the County Council, is leading for the Best Start in Life. And Anna Brinkoff from Gloucester City is leading for Housing. So what we'll do when Andrew has done the minutes, I'll email my other leads to make sure they're very clear on the action and the ask of them. And I think just to re-emphasise why we're emphasising the role of the board member is in the past what we've had are a lot of officers come into the board presenting work. Also had board level sponsorship, but we really want to engender some ownership from the board members on the different priorities. And we had some feedback about this in the committee, although that seems like quite a long time ago. So I think our role as board members championing our priorities and taking that work forward is really important. So I'll stop there. Hopefully I've captured all the points in the discussion.
Thank you, Sarah. The only point I would add is just really to re-emphasise that this is about action-centred. We've got a brilliant strategy which is already slightly dated and needs to be much more responsive, and that will be woven in. But we're about action, we're about doing something. So the 7 leads have got a significant role to play and deliver in terms of the action plan. And then as a board, we need to monitor all of the strands and look for the overlap and integration that we need, because none of these things stand alone, and priorities will change. I mean, Chris and Martin very clear that the mental health strand has lifted, and Angela will have a responsibility to cover that in perhaps more depth, but nothing is less important than the other. It's just the emphasis will be different as we move along this journey, but the key issue is the one about action. So the board is recommended to review and agree the wording for the Gloucestershire Joint Health and Wellbeing Strategy, and I get the feeling that members are supportive. Yeah. Thank you very much. So thank you, Sarah. So we now move on to item 12 on the agenda, which is Child-Friendly Gloucestershire, an update, pages 171 to 196. And this is Andy Dempsey and Dame Janet Trotter.
Thank you, Chair. Perhaps if I could say a few words. It's Andy Dempsey here. Hopefully you can hear me. It'd be great if Andrea nodded, and then I know you can hear me okay. Okay. There are 3 elements to this. A very short and I hope succinct covering report. At Appendix 1 was the strategy that was, or vision statement more appropriately, that the board looked at in March, and then an update in Appendix 2 on some of the consultation that's taken place since March. Cognizant of what Sarah said earlier about membership of the board changing, I'll just make a few set the scene with a few remarks. The genesis of this work is the absence in the county of a single overarching vision for all children and young people. We very clearly, as a partnership, have arrangements to safeguard children. This is about their general well-being, their personal, social, cultural and educational development. The vision that you looked at in March, we thought it prudent to bring back, because as it says in the covering report, firstly, can I suggest the board was probably preoccupied with COVID in March, and the world has become increasingly preoccupied by COVID since then. So we thought, firstly, we should bring this back, acknowledging that COVID is necessarily requiring us to flex all our strategies. What you will see from the consultation, which Dame Janet will speak to as well, is that there's a good congruence in the views of young people with the priorities we identified in the vision documents, which are in pages 178 and 179 of the vision document. So we think the overarching priorities are broadly right, and they align very closely with Leadership Gloucestershire's Vision 2050 document. So there's a good golden thread there. And as you've said, Chair, that we need to move to the action phase. We've been able to progress consultation, and we think that's been very fruitful, but we're really conscious now we need a mandate for the board. And I suppose, without sounding impertinent, It's now, do we really think those are the right priorities? Because they are pretty bold. They are some strong commitments. Necessarily, I think we want it to be aspirational, because I think the consensus of the board and the evidence shows that whilst outcomes are okay, they're not as good as they could be for all children, and they are not particularly good for the most vulnerable. So, we really want to raise the bar. So really, we brought it back today just to test that the commitment was still there. We think it is. We flagged within the paper the need to refine our approach in light of COVID, and Janet and I will be coming to see members of the board individually in the districts. We now want to move to the action phase. We very much think the pre-birth to 5 years is the place where we can start this project and give it some materiality and substance, because that really does provide the foundation for the journey of children through the rest of their lives. So I'll pause there and hand over to Dame Janet, if I may, and hope that's been a useful scene setter. Janet, are you there?
Yes. Can you hear me?
I can see you.
I don't know. I'm going to carry on talking, if that's okay. So, yes, I just wanted to say how what a privilege it is to come to the board and to listen to the seriousness of the debate. If I can carry on from where Andy left off, I think the pandemic has focused much more on the needs of young people and the inequalities. And whereas we look at the BAME community and can see very particular things arising from a lack of equality there, we do see that with young people. And we have taken over the last few months comments from 10,000 young people. And the survey that you've got at the back of your pack just relates to 600 young people who responded during COVID. So it's very much just off the press. And this does report on mental health, which has come up before in this meeting. It shows young people very concerned about the future and their prospects for jobs and so on. And actually what we do know is that quite a few of the young people, and the very young, have not had the same access to learning opportunities during COVID. So there are very particular needs for young people. And I suppose I would want to say that the matter is urgent. We really want to get on with this with your agreement. We want to be collaborative in style with young people, with communities, with parents, with voluntary and statutory agencies. I guess we're really trying to bring the voice of young people into some of the debates that affect them and their future. We want to coordinate services, so really put services in touch with one another so that by and large, young people can access the services available to them as quickly and as seamlessly as possible. And I can remember talking to some young people about mental health and them saying just how difficult it was to access some of the services in a timely way. Also, contraceptive, family planning advice and so on. So we want to be very much forward focused on young people. I think we should say we're trying to raise the aspirations of all. And I think that some of that may break eggs. And I think it's the nervousness of Andy and myself about that, we need to keep coming back and touching the Health and Wellbeing Board again and again, because I'm not sure when you talk to a lot of people about inequality and addressing inequality in Gloucestershire, they really know what that means. It sounds nice, but actually there are some hard issues to this, and I think we need to be prepared to address those for the good of young people, for the good of the population of Gloucestershire. So we want to be dynamic, and we want your agreement to go forward.
Thank you very much, Dame Janet. I, for one, am very happy to break eggs. And I'm very happy that you've both worked with Andy and Isha to bring forward this paper. I just ask if members have comments or questions to make, please.
Chair, would you like me to go through the number of hands up?
I would, yes, please, because I can't see anyone at all.
So I think I've got Chris, then Mary, Angela, John, Darren, David, and then Richard Boyles. So I'm hoping none of those hands are left over from last time. So that would mean that Chris Spencer goes first.
I'm ashamed to say it's a leftover from the last item, but no doubt I'll think of something to say a little later.
Okay, then. So Mary's taken her hand down. So that takes us to John McGinty then.
Thank you, Chair. I just want to say very happy to endorse the recommendations and the ongoing work over the summer period for this. I think the observation I wanted to make in particular was that I see an awful lot of overlap in the work of this particular piece of work and the work that I was asked to take forward from Leadership Gloucestershire a year or so ago about social mobility in the county. Because although that's not progressing quite at the pace that Andy and Janet are taking forward this piece of work, what we have been able to establish is it's the progress of young people through those early life stages that seems to have the biggest impact on the poor social mobility performance that we score as a county and different parts of our county. So we were already looking to commission some work about sort of diving into some of those indicators as to why people's progression through those early life stages is having such a big impact on their later life outcomes. And it'd just be helpful, I think, from when Andy's coming around talking to the districts, if he could also engage with me just to try and work out what the linkage and commonality is between us taking forward the social mobility work and this piece of work. Thank you.
Okay, we next then had Darren.
Yep, thank you. Very supportive. For Cheltenham, improving the outcomes for young people is definitely a priority for us. I'm also just pleased to add that we'll be launching the No Child Left Behind Cheltenham Agreement with schools in September. So please, I'm happy to provide an update at the next meeting. And I just want to, just flag up the environment we're now working in. We've now got a situation where the job environment for young people is more challenging because normally young people go into things like retail or hospitality as they begin to take their first steps into the workplace. And those opportunities may not be around because of the situation we find ourselves in. So the urgency regarding this work is now more greater than ever. And linking back to our very first discussion about social value, this again could be an area where we may want to align our social value policy and objectives where we do make investments and spending. Can we leverage some social value to improve outcomes for young people? So fully supportive, and Cheltenham Borough Council will do whatever it can to support this work. And that's it from me. Thank you.
Thank you. So that brings us on to David.
Yeah, likewise, very supportive of this piece of work and cracking on with it. It chimes so well with the local industrial strategy. It's why we commissioned the survey of over 5,000 young people for the local industrial strategy, because our biggest challenge in Gloucestershire is our demographic challenge of an ageing population, ageing more rapidly than the UK average, and our lack of ability to keep or attract young people into Gloucestershire. So it's something that's really important to the LEP in terms of recovery planning and the impact of COVID. We know we haven't seen the half of the economic impact yet. We've got the figure on furloughing's gone up to 89,000 in July. A lot of those people will be young people. We know that when we have economic downturn, young people and those furthest from employment are the hardest hit and find it most difficult to get into employment. So we definitely need to crack on with this piece of work, and we'll do what we can in the LEP to support.
Thank you. Okay, so then Richard.
Yeah, thanks very much. I'd first of all like to thank the PCC, Martin Searle and Dame Janet for this initiative and the work that's been done over the last couple of years, and also the DCS, Chris Spencer and Andy Dempsey, for the input that they've done on behalf of GCC. Going on to the document itself, pre-birth to 5 years old, it's pivotal to capture young people and young families early and develop that best start in life. Getting access to early years for families to prepare not only the family but the children themselves for the rhythm and structure and the importance of education as they go forward, and developing aspiration across all of our communities wherever they start in life is the most important thing that we can do, so that people actually have choices when they grow up and get to where they want to go in their lives. So thank you very much for the work you've done.
Thank you, Richard. I think that just brings us to Mary.
Thank you. I really do welcome the report, and reading the survey results is quite painful, I think, really, when you see the feedback you get from some of the young people. I thought the cost of work experience, the cost of uniforms, and I think some of this can be worked through. And it's true that we need to look carefully at work experience in our system to ensure that those who are in the areas of inequalities get equal opportunity is something I've talked about for quite a long time. And looking at things like unsafe play areas, some of this can feed across into some of the plans they're putting together for physical health and activity. So we just need to think carefully about how we will actually really focus on children in those plans we're developing. But certainly we need to do more work with young people to understand their needs, and we need to really commit some resource and time to this work to ensure that we actually have a plan that makes a difference in Gloucestershire.
Thanks, Mary. I don't think there's anyone else, Chair, with their hands up, but just to say that Rob Weaver from Tewkesbury has put in a supportive comment in the written comments. Now I can see Chris has put his hand up. Go ahead, Chris.
Yeah, sorry, Sarah. Of course, I would commend this plan as the sponsor of it, or one of them. I do think it's a good plan, and I think it's a right approach, because I think underlying this, there's some hugely critical issues that we have to address as partners. For example, and it's just an example, we've now got 4,000 children in Gloucester City alone that are attending failing academies or schools overseen by a multi-academy trust. That's 4,000 children in failing schools. Previously, we know that we've been concerned about schools in the Forest of Dean as well, and tagged onto that small rural primaries in particular. So there's a major issue here. If you believe that a good education is the only sure way out of poverty, and as Richard said about underpinning the local industrial strategy and the 2050 vision, then this is absolutely seminal to improving our well-being as a county as a whole. And so, you know, I would implore people to get behind this. I know we are, but to use our influence more broadly beyond this group to get others behind it, because it's critical. I do think we need to get to grips with, you know, these issues like the underperformance of schools in Gloucester City, and particularly academies, which fall squarely within the responsibility of the Regional Schools Commission, and not me, I hasten to add, as Director of Children's Services. But nonetheless, even though they're not our schools, they're our children. attending these schools. And so we do have to adopt a systemic and collaborative approach to working with all the partners in schools, whether that be the diocese, the Regional Schools Commissioner, Ofsted, systems leaders within schools, as well as ourselves. Because the other problem, if you look at the intelligence and performance data around schools, is that Andy alluded to the gap between vulnerable children and those with special educational needs compared to the general population of children as being wider than the national average. It is, and it is quite significantly so, and that is a feature of a failing school system. That if you get poor schools, those that suffer most are those that have got most need for a good education. And so this is a really critical strategy, I think, and one that will lend huge weight to my discussions with schools about a more collaborative approach to trying to deliver a high quality education.
I think that's all the questions now, Chair.
Thank you very much. We've talked about the impact of COVID on our young people and this particular element of work, but I would suggest that the COVID pandemic has given us the opportunity to expose these in a more public arena, these issues, and it's also given us the opportunity to do something about it. So I fully endorse the paper and the work that's going to happen during the summer and the collaborative work that all partners are going to have to play in this to actually improve the lot of our young people, and particularly young women having babies and being able to enable them to actually move through their lives in a much stronger and better way. So I ask members to actually look at the recommendations for this paper. The Health and Wellbeing Board is asked to note the report and to support the continuation of work over the summer period in order to develop areas of work wherein intervention and support will have a lasting impact, and continue to engage key partners and stakeholders in order to build support and gain their insights. So I'm looking for support or any dissent. Looks fine. I'm seeing that no one's dissenting and everyone's in full support and very keen to actually move this on. So thank you very much, board members. And thank you very much for the authors of the report. Well done. I just need to check with Andrea. I've come to the end of my papers. Is that the end of the meeting?
Yes, Chair, we have reached the end of the meeting.
Thank you very much. I would like to thank everybody for their support and their attendance, and for everybody that's got an expanded role from now on in and through the summer. Please talk with Sarah, please talk with myself, so we can move these actions forward. Because one of the key things about the Health and Wellbeing Board is we have superb input, we have really good database now, or gaining it, but we need to get much more action centred and deliver. So thank you very much. I look forward to seeing you, if not through the summer, then at the next meeting. Thank you.
Okay. Nigel, can we end the live feed then, please?
There will be a slight delay and then I'll come back to you.
Thank you.
Okay, the feed's now